Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a self-myofascial release technique for the rectus femoris. The rectus femoris is a two-joint muscle that flexes the hip and extends the knee. When this muscle is dysfunctional, it will inhibit or shut off the glute max, which will prevent it from firing on time when walking and running. The technique I'm about to demonstrate is a two-part technique. The first part uses a lacrosse ball to deactivate a myofascial trigger point in the tendon where it attaches at the hip. The second part uses a foam roller or PVC pipe to address the muscle belly and inferior attachment where the muscle merges with the other three quadriceps and forms the quadricep tendon. To achieve the ischemic compression component of this technique, we are going to locate tender areas or myofascial trigger points and apply direct force into those tender areas with the lacrosse ball and or foam roller for 20 to 30 seconds or until the discomfort becomes less intense. To achieve the self-myofascial release component of this technique, we are going to apply direct force into the fascia in the area for 1 to 2 minutes. For the first part of this technique, we are going to locate the tendon where the rectus femoris attaches to the hip. So we're going to locate the anterior superior iliac spine, or ASIS, which is a bony prominence that sticks out and can be palpated on the front of the pelvic bone at the very top. So once we've located the ASIS, we are going to locate another bony prominence called the anterior inferior iliac spine, or AIIS, which is going to be about 1 inch inferior or towards the foot and 1 inch medial or towards the midline of the body. So at this point, there should be what feels like a hard bony area beneath a few layers of muscle, right? So if it's too squishy, you went too far medial, right? And if you don't feel that kind of hard end feel, then you're not in the right spot, right? So for the second part of this technique, what we are going to do is we are going to run the foam roller or PVC pipe, right, from just below that down the center or middle of the upper leg to just above the knee. The first part of this technique, we're going to locate the tendon where the rectus femoris attaches to the hip bone. So I'm going to find my bony prominence that pokes out in the front and top of my pelvic bone. And then I'm going to move about 1 inch inferior towards the foot and 1 inch medial or towards the midline or belly button. So once I find that second bony prominence, I'm going to place the ball directly on top of it, and then I'm going to apply force by pushing the ball into the wall. So I'm going to move it inferior slightly or towards the feet until I find that myofascial trigger point. And once I find it, I'm going to apply direct force into that trigger point with the ball for 20 to 30 seconds or until that discomfort becomes less intense. For the second part of this technique, I'm going to use a PVC pipe. Again, you can use a foam roller or even say a small medicine ball, one of the harder medicine balls, which will actually give you more pinpoint force into those trigger points when you do find them. But what I'm going to do, and again, we're going to start at the hip, so just below that AIIS that we addressed with the lacrosse ball. And I'm going to split this muscle into two parts, an upper half and a lower half. So what I'm going to do is I'm going to search through the upper half looking for trigger points for about a minute, and then search through the bottom half of that muscle looking for trigger points again for about a minute. So if I found 2 trigger points or tender areas within each half of that muscle, I'd end up with force into the fascia, the rectus femoris, for 1 to 2 minutes. So again, going to start near the hip and roll inferior, looking for tender areas of myofascial trigger points. Once I find them, I'm going to pin them down for 20 to 30 seconds or till they become less intense before moving on to another section of that muscle and trying to locate another trigger point or tender area. And then work the lower half of the muscle, so from about the midpoint of the upper leg to about an inch above the knee. And again, just looking for tender areas that I can apply direct pressure to for 20 to 30 seconds.